Welcome to Volunteer Management and Public Health's Role. According to the Centers for Disease Control and Prevention, volunteer management is the ability to coordinate the identification of, recruitment, registration, credential verification, training, and engagement of volunteers to support whatever public health role is in a response. It's important to note that this process does not occur in a silo. There may be other needs for volunteers in an event. So the question is, can this whole process be coordinated? Not just public health, healthcare, or medical volunteers, but all volunteers needed for the response in general. I think it's important to talk about the tiered approach, the tiered medical response system as it relates to volunteer management. So to review, remember there are 6 tiers within the tiered response plan. Tier 1 would be managing volunteers within the impacted healthcare organization. Think of it as a clinic or a hospital or whatever agency is being impacted and needing a surge in volunteers. Tier 2 would be managing volunteers within the area that is involved. Very often this is referred to as local emergency operations coordination. Tier 3 will be managing volunteers within the region. And what we're referring to when we say region is the Healthcare Coalition region. So for us, that would be the Northwest Wisconsin Healthcare Coalition. Tier 4 is managing volunteers within multiple regions. So think, for example, of the Northwest Wisconsin Healthcare Coalition and another region being impacted to the point that they're both requesting volunteers. Tier 5 would be managed at the state level. And Tier 6 through FEMA Region 5 would be managed at the federal level. Important players in the whole capability of volunteer management, again, would be the healthcare organizations, public health, emergency management, NGOs or non-governmental organizations, and you can see some of those that are identified on the screen. So there's lots of tiers and lots of partners, and you may be thinking to yourself, how does it all fit together? Based on traditional emergency response, the answer is the incident command system. It's not just one entity's responsibility, it really is everybody's responsibility to work together in a unified approach. This process is usually managed at what is referred to as a volunteer reception center, whether it formally is set up or informally, working with emergency management and the workforce staging coordinator. The priority functions for public health as it relates to volunteer management are to 1, coordinate volunteers, 2, notify volunteers, 3, organize, assemble, and dispatch volunteers, and 4, demobilize volunteers. Again, is there a common way? Is there an evidence-based best practice out there that currently exists to carry out these important functions? The answer is yes, and that system is the Volunteer Reception Center. So directly out of the Volunteer Reception Center course, the overall purpose of a VRC is turning that crowd of spontaneous volunteers into an asset instead of a liability. Some of the best practices and lessons learned of volunteer reception centers are that there really is no single right way to do it. No single system fits all emergencies, locations, and specific local needs. But there are some things that they do have in common. They do have a formal process that every volunteer goes through, that being the interview, the referral, the general safety briefing, which is a liability issue, and badging. Badging simply lets people know that that volunteer belongs there. There is background checking, which is referred to as credentialing. So having their identity and license verification of every spontaneous volunteer checked. Basic safety training, documentation, forms are completely filled out and verified on all volunteers. And then the key really is putting those volunteers in a job on a specific time frame and really within their scope of practice. So in a large event, does public health take care of its own volunteers? Does the hospital manage its own? Does emergency management do its thing with its volunteers? And do other organizations simply do their thing? Or does that seem redundant and potentially a waste of time and resources? The purpose of a VRC is really to bring all those things together under one roof. Here, the volunteers would be triaged through the system to be connected with the best fit. Public health and healthcare volunteers can go to the local Weaver administrator, the Wisconsin Emergency Assistance Volunteer Registry. Those people are already affiliated with a volunteer agency can go to their respective representatives. For example, the Lions, the Kiwanis, the VOADs, the volunteer organizations active in disasters. And then truly spontaneous volunteers, those that aren't affiliated with any agency, they can be targeted to the most appropriate location based on their skill sets. So function 1, planning within the tiers for volunteer management. Remember, we're talking about the first 3 tiers of the tiered response plan within your agency, within your area, and within your region. So think about how you would manage volunteers internally. Do you keep a local list? Do you have no list? Would you rely on Weaver? Would you reach out to local emergency management? Ask yourself if you're ready with any one of those options. If you're overwhelmed at tier 1, how would you manage within your area? Who would you reach out to? Traditionally, this is where a local emergency operations center gets activated. Next, how about within your region? So for us, again, it's the entire region of the Northwest Wisconsin Healthcare Coalition. How could we possibly go about recruiting and managing volunteers within an area so large? So ask yourself again if you can do the following. Can you screen volunteers? Do you have the paperwork to fill out? Can you credential them, badge them, provide just-in-time training, assign them to an appropriate activity or task within their scope of practice? Can you monitor their safety, and can you demobilize them? Function 2 is notifying volunteers of a potential deployment. Again, think within those first 3 tiers. Can you mobilize within your agency, your area, and your region? There are some systems currently in place that allow the notification of pre-identified volunteers. We talked about the Weaver. Again, think of Weaver as healthcare specific, really focusing on public health, medical, and mental behavioral health volunteers. Another system which is managed through Wisconsin Emergency Management is Volunteer Wisconsin. Also, the United Way has a very robust volunteer management system, and the multitude of Wisconsin VOADs, again, voluntary organizations active in disasters. Just envision a representative from each one of these entities under one roof in a volunteer reception center. How about Healthcare Coalition staff? How will they play a role in the coordination of volunteers within either an area or within a region? Again, lots of systems, lots of silos. What brings it all together? And we point back to the volunteer reception center. Function 3 is organizing and assigning volunteers. Could you do it if each healthcare coalition partner does their own volunteer management? I think the answer is yes. There would probably be a lot of redundancy and overlap. Or again, could it be done under one umbrella? So think of it like this. Can all the systems be brought together under one roof with a direct connection to incident command, who ultimately will approve all volunteer deployments? There are a couple systems to track this. One of those is the traditional ICS forms, the 211, which is the workforce sign-in, or a online system called ERMS, Emergency Response Health Monitoring System. Lastly, when the volunteer management needs are no longer needed, you need to demobilize your volunteers. Again, this should be done through the traditional incident command system through workforce staging, the volunteer reception coordinator, and the volunteer reception center itself. Tracking is critical. There must be a system in place, whether it's paper or electronic. The rationale for that is, can you track the health of your volunteers pre-deployment, during deployment, and post-deployment? Again, this is a liability issue. So what does that all mean for you ultimately? So where the rubber hits the road, does each jurisdiction have the capacity to carry out the 4 functions that have just been identified? I would argue the answer is no. ultimately you're going to be knee-deep in a response. Volunteer management is a function that can be delegated. You delegate it by bumping it up through the tiered response protocol. So from tier 1, if you become overwhelmed, bump it up to tier 2. Traditionally, that means reaching out to local emergency management and asking for support through the Emergency Operations Center. If that structure is not able to meet your needs, we would encourage you to consider the region, or tier 3. This is where healthcare coalition staff and the consortium director will assume a coordinating role. This is our skill set. We know this subject matter and we can support you. Again, we do not assume a command role. Command stays local. We assume a coordination role and offer you options in terms of support. We are area and region administrators for Weaver, and we can create missions on your behalf. You simply need to ask. For more information on volunteer management, you can see some of the resources on the screen, or feel free to reach out to the consortium director at any time. Thank you.